there, my name's Katie Lindsay. This is my final checkoff. This is Jasmine back here. I'm going to do a full pan of the room. I'm just going to double check that I can stay in frame while I do this. Okay, these are all of my supplies right here. I've got my stethoscope, my pen light, my Rosenbaum chart, and all of my PPE on. Okay. Hi there, my name is Katie Lindsay, and I'll be the student nurse today. I'll be doing a full checkoff on you, full assessment. Is that all right?
Yeah.
Okay. Can you tell me your full name and date of birth?
My name is Jasmine Shotwell, and my date of birth is 7/18/92.
And what name can I call you?
Jasmine is fine.
All right, Jasmine. I'm going to go ahead and wash my hands and put on some gloves.
Okay.
Gloves are stuck. Okay, so we're going to start off with a general inspection. Jasmine appears healthy. She has a neutral and calm affect. She appears to be her stated age. Appearance is consistent with age. Her nutrition seems good. She seems well nourished. She is well groomed and clean, and no body odors are detected. Her dress is appropriate for situation and weather. Her body is symmetrical and posture is good and erect. She does not have any obvious deformities. There are no obvious involuntary motions such as a tremor or a tic. And can I go ahead and have you stand up and
Yep.
walk so I can see your gait? Okay. Gait is smooth and even. Yeah, you can go and sit back down. Gait is smooth and even. No assistive devices are used. I do not detect any signs of distress or restlessness. Eye contact is good. She will look me in the eye when I speak to her. Her speech is articulate and clear. Her conversation is good. She responds appropriately to questions asked. And I'm going to go ahead and ask you, where are you right now?
At your house, Nick's house.
What's today's date?
Today's date is the 17th
Okay.
or 18th, I'm not sure.
And what's your name?
Jasmine Shotwell.
Okay. Patient is awake, alert, and oriented. And then her facial expression is appropriate and equals her verbal expression, and her behavior is appropriate for the situation. Next, I will be doing a skin assessment. So, an overall, yeah, I'm gonna go ahead and see your arms and pull up your leg pants. Pull up your pants so I can see your legs. Okay. So, skin color is overall appropriate for ethnicity and is consistent over the entire body. I'm gonna go ahead and feel your arms here. Okay. Skin is warm, dry, smooth, and intact overall. There are no lesions or edema noticed. I'm going to go ahead and pinch your hand here. Okay. Skin mobility and trigger is elastic and good. Skin returns to place immediately after displacement. And then her hair distribution is good and appropriate for age and gender. I'm going to go ahead and check your nails. Your nails are pink. They are intact, smooth overall. They are well groomed and clean. Her refill is less than 3 seconds in both hands, and can you go like this? Okay. The base of the nail angle is 160 degrees, which indicates no clubbing, and there are no lesions noticed. Next, we're going to move on, and I'm going to inspect your head. So head is normocephalic and centered on the midline axis. Her scalp is intact. There are no lesions, flaking, or scaling noticed. Do you have any tenderness if I would press on it?
No.
Okay, great. No tenderness is reported. And then her hair is clean, well groomed. It has a fine texture. It's soft and shiny. So that's good. Then we're going to move on to your face. So face is symmetrical. Can you squish your eyes together like that? Okay, great. Can you puff out your cheeks? Okay. Cranial nerve 7 is intact. And face is symmetrical. There are no lesions or edema noticed on the face. Next, we're going to move on to your eyes. So your eyebrows, they are symmetrical. There is no hair loss noticed. There's no lesions, flakiness, scaling, anything like that. Your eyelids the color is appropriate for ethnicity. There's no edema noticed. For eyelashes, there's no hair loss noticed. Eyelashes are evenly distributed across the eye. They point outward and upward on the top lash, or top lid, and then outward and downward on the bottom lid. Next, I'm going to look at your conjunctiva. The conjunctiva is pink and clear. The sclera is white and clear. And then your corneas are transparent, smooth, and shiny. Your irises are brown and round. And then I'm going to go ahead and check your pupils. So I have my pen light here. And I'm going to turn off this light and check your pupils for reactivity. So when the light was on, I noticed your pupils were about 4 millimeters. And so now, they do react to light and accommodate the light by going down to about 2 millimeters in size. So they are equal, they're round, reactive to light, and accommodation. So now I will test your extraocular eye movement. Just keep your head straight and follow my finger. Okay. Alright, great. Extraocular eye movement is intact, and cranial nerves 3, 4, and 6 are intact. Next, I'm going to test your peripheral vision. So I'll wiggle my fingers like this, and tell me when you see them, alright? I'm going to go and place my hands behind your head.
I see them.
Okay, great. Peripheral vision is intact. Now to test your normal vision, I have a Rosenbaum chart with me. So hold it 14 inches in front of your face and read the smallest line you can.
Okay, I see 4, 2, 8, 3, 6, 5.
Okay, so both eyes are 20, 40. Next, cover your left eye. Read it again.
4, 2, 8, 3, 6, 5.
Okay. So the right eye was 20, 40, and then cover your right eye.
4, 2, 8, 3, 6, 5.
Okay. Left eye was also 20, 40. So both eyes are 20, 40, left and right eye for 20, 40. And this indicates that the cranial nerve 2 is intact. Next, I'll be inspecting your nose. So the nose is symmetrical on the face. It is midline on the face, symmetrical on both sides. The skin is intact. There are no lesions or discharge noticed. And skin color is appropriate for ethnicity. Next, I'll be assessing your ears. So according to our conversation, I have decided that her hearing is intact, and this means that cranial nerve 8 is intact as well. So, inspection of her ears. Okay, ears are symmetrical. They, the pinna of the ear is aligned with the outer canthus of each eye. They are between 4 and 6 centimeters long. The skin is intact, and there are no lesions, discharge, edema, and no deformities are noticed. The skin color is also appropriate for ethnicity. So then we're going to assess your mouth. So let's see, your lips are pink, moist with no lesions. Can you say ah?
Oh.
Okay. Cranial nerves 9 and 10 are intact from that assessment. Oral mucosa is pink, moist with no lesions and no odor detected. The gingiva is also pink and moist with no odor detected and no lesions. The teeth are white, none are missing or broken. The pharynx is pink, moist, smooth, with no lesions. The tonsils are pink. There's no enlargement noticed and no lesions. They're pink and moist. Can you stick out your tongue for me? The 12th cranial nerve is intact from that assessment. The tongue is symmetrical. It is pink, moist, no lesions are noticed, and it has a slightly rough surface. Okay. Next, I'll be assessing your neck. So I'm just going to go look at it. Okay, the neck is centered on the midline of the body. I'm going to go ahead and palpate your trachea. Okay, trachea is midline on the throat. There are no lumps or masses felt, and skin color is appropriate for ethnicity. Next, I'll be assessing your thorax. So I'll begin by assessing your respiratory rate. Okay. Respiratory rate is about 14. Breathing is quiet and effortless with an even respiratory depth. And the chest wall rises and falls symmetrically without effort. So next I'll be inspecting your anterior thorax. So your anterior thorax, the ribs slip down at a 45-degree angle. It is symmetrical, and the muscle development is good and equal. The AP to lateral diameter, I'm going to measure with my hands. Okay, and then come over to this side. So the AP to lateral diameter is about 1/2 or a 1:2 ratio. Next, I will be auscultating your breath sounds on your anterior thorax. So I need you to take a deep breath every time I move my stethoscope.
Okay.
Okay. Breath sounds are clear and even bilaterally. Bronchial sounds are heard over the trachea. The bronchiovesicular sounds are heard over the main bronchi branches in the central part of the chest. And then the vesicular sounds are heard in the peripheral lung fields. So next I will be assessing your posterior thorax. So if you could turn. Great, okay. Just want to be able to see what we're doing here. So I will go ahead and inspect it. So the posterior thorax is symmetrical, muscles are well developed, and symmetrical. The spine is midline to the back. It is straight. The scapula are bilaterally symmetrical, and the ribs are sloped at a 45-degree angle relative to the spine. Now I will auscultate the posterior lung sounds. Posterior breath sounds are clear and even bilaterally. Bronchiovesicular sounds are heard over the main bronchi. And then the vesicular sounds are heard in the peripheral lung fields. Okay. So now we'll be doing a cardiac assessment. So first, I'm going to have you lay down. So you can get your head over here. Chest wall is rounded. There are no obvious pulsations noticed. You can go ahead and sit up.
What's that here?
Yeah, stay there. Okay, so now we're going to feel for the apical pulse. The apical pulse is felt at the left midclavicular line at the 5th intercostal space. And because she is a woman, we're going to go a little bit lower. Oh, wait, sorry. There you go, that's right. Yeah. There we go. Perfect. Okay. So the apical pulse is felt at the left midclavicular line in the 5th intercostal space. I'll now auscultate the apical pulse for a full minute. Apical pulse rate is 78. Rhythm is consistent and even. I will now actually auscultate the mitral valve point with the bell of my stethoscope in order to hear if there are any abnormal heart sounds. No extra heart sounds or murmurs are heard, and the apical pulse and mitral valve were heard at the left midclavicular line in the 5th intercostal space. Okay, now I'm going to ask you to lay down again.
You want to look at this one?
Yeah. And can you turn your head to the left and then again to the right?
You want to-
Okay. And there's no jugular vein distension. And I'm going to go and palpate your carotid pulses. Okay. Carotid pulses are present plus 2 equal and even. You can go ahead and sit up. Relax your arms. Palpate your brachial pulses. Okay, brachial pulses are present plus 2 equal and even. Now palpate your radial pulses. Okay. Radial pulses are present plus 2 equal and even. Now palpate your posterior tibial pulses. Posterior tibial pulses are present plus 2 equal and even. And the dorsalis pedis pulses. Dorsalis pedis pulses are present plus 2 equal and even. And that does it for cardiac. So now we're going to be assessing your abdomen. So go ahead and lay back down. Actually, I need to be on your right side. So you can flip around, sorry. Perfect, okay. So, assess it from this end. And, well, let me assess it from your head side. Okay. So the abdomen, the color is consistent with the rest of the body, is appropriate for ethnicity. There are no striae or scars noticed. There is no pulsations or peristalsis noticed, and the contour is flat. Now I will be doing an auscultation of your bowel sounds. So do you have any pain or tenderness?
No.
Okay. Switch it back to diaphragm. Okay, so I will start off at your right lower quadrant. Okay. Bowel sounds are heard in all 4 quadrants. Now I will do a light palpation of all 4 quadrants. Tell me if you feel any pain or tenderness. So in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, do you feel any pain? Okay. No pain or tenderness is reported, and the muscle tone is good but relaxed. Now I'll do a deep palpation of all 4 quadrants. Okay. In the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Do you feel any pain?
No.
No pain or tenderness is felt, and no masses or aortic pulsations are noticed. Okay, you can go ahead and sit up. Now we're going to be doing a musculoskeletal assessment. So just from an overall observation, extremities are symmetrical. You can go and stand up for me. Spine is straight with expected curvatures. Knees, hips, and ankles are in alignment, and feet are flat on the floor. Muscles are also symmetrical. So we're going to be doing a couple of range of motions. So just follow what I do. So might be easier if you face me.
Okay.
Yeah. Okay, great. Awesome. So we're going to start off with your neck. So go ahead and bend your neck down like this for flexion. Back up for extension. Look left and right for rotation. Look, put your ear there, like that, for lateral bending, and then shrug your shoulders. And cranial nerve 11 is intact from that movement. Next we're gonna, and so did you feel any pain or tenderness while doing those? Okay.
No.
So cervical range of motion is full, and there's no pain or tenderness reported. So now we're gonna do your like thorax. So go and bend and touch your toes. You try to get as close as you can. This is flexion. And stand back up for extension, and turn side to side for lateral bending. Twist for rotation. Did you feel any pain or tenderness?
No.
Thorax has full range of motion and no pain or tenderness reported. Next we're going to do your shoulders. So go ahead and raise your arms up like this.
Okay.
And that's flexion, and bring them down for extension. Raise your arms out to the side for abduction, and then back down. And cross them for adduction. And adduction with the other arm. Great. Next, put your arms behind your head, and this is external rotation. And then back behind your back for internal rotation. And did you feel any pain or tenderness?
No.
Okay. So shoulders have full range of motion with no pain or tenderness reported. Next, we're going to do your elbows. So go ahead and go like this for flexion. Oops. That's good. Sorry, this is flexion. And then extension. Okay. Elbows have full range of motion. No pain or tenderness reported. Next, turn your hands like this. So forearms, this is supination. And over, that's pronation. So forearms have full range of motion, and no pain or tenderness is reported. Next, we're going to do your wrists. So go ahead and bend them like this for flexion, and then back up for extension. Okay, in for radial deviation, and out for ulnar deviation. Okay. Wrists have full range of motion, and no pain or tenderness is reported. Next, we're going to do your hips. So you can go ahead and lay back down. Yeah, go and lay down.
Lay down. Okay.
Yeah. Okay, you pull your knee up to your chest for flexion, and then put it back down for extension, and the same thing with the other leg. Flexion and back down for extension. Go ahead and bring your leg out for abduction, and bring it back in and cross it. Sorry, for adduction. And then the same thing with the other leg as much as you can. Maybe go up like that. Yeah, okay. Abduction, and then cross it for adduction. Great, okay. You can go and sit up. Actually, go and stand again, sorry. Hips have full range of motion with no pain or tenderness reported. Now we're going to do your knees. So can you put your foot to your butt? That's flexion, and extension is bringing it back down. And flexion, and extension. Okay, knees have full range of motion with no pain or tenderness reported. And then, let's see, you can sit down and try to have your feet hanging as best you can, so scoot back a little. Okay, so go ahead and flex your toes to the ceiling, that's dorsiflexion, and point them towards the ground, that's plantar flexion. Okay, ankles have full range of motion with no pain or tenderness reported. And then turn your feet inward for inversion, and outward for eversion. Great. Feet have full range of motion with no pain or tenderness reported. Next, I'm going to need you to hold out your arms like this in front of you. I'm going to push on them, and don't let me push them down. Okay, and then don't let me pull them up. Okay. Upper extremities have a 5-5 for muscle strength. And then same thing with your legs, pull them out. Don't let me push them down. And don't let me pull them up. Okay. Lower extremities have a 5-5 for muscle strength as well. Now for the final bit, we're going to do a neurological exam. So what we're going to do, I'm going to touch you with this cotton swab, and this is going to test your light touch sensation. So yeah, go ahead and pull all that stuff up. And what I'm going to need you to do is close your eyes and point to the area where I touch you with this cotton ball.
Okay.
All right. Close your eyes. Yeah. Okay. So light touch sensation is present. She was able to feel all of the extremities. So finally, we are going to do a sharp and dull sensation. So this is my tongue blade, which I've broken in half. This is the sharp side, this is the dull side. And so I need you to tell me if you feel sharp or dull and point to where you feel. So same thing as last time, close your eyes.
Sharp.
Okay.
Sharp. Dull. Dull.
patient has is able to feel both sharp and dull stimuli and has full sensation. I think that's it. Thank you.